నమస్కారం జీవన రేఖ కార్యక్రమానికి స్వాగతం. సాధారణ బీపీ అంటే ఏంటి? హైపర్ టెన్షన్ అని ఎప్పుడు చెప్తారు? బీపీ లక్షణాలు ఎలా గుర్తించాలి? బీపీకి ఎలాంటి చికిత్సలు అందుబాటులో ఉన్నాయి? బీపీలో సిస్టోలిక్, డయాస్టోలిక్ ప్రెషర్స్ అంటే ఏంటి? బీపీ నివారణ మార్గాలేంటి? అమోర్ హాస్పిటల్స్ నుంచి కన్సల్టెంట్ ఇంటర్వెన్షనల్ కార్డియాలజిస్ట్ డాక్టర్ ఇమ్రాన్ గారు మనతో పాటు ఉన్నారు. వారిని అడిగి డీటెయిల్ గా తెలుసుకుందాం. అలాగే మీకు కూడా ఎలాంటి డౌట్స్ ఉన్నా స్క్రీన్ మీద కనిపిస్తున్న నెంబర్స్ కి కాల్ చేసి డాక్టర్ గారితో మాట్లాడొచ్చు. నమస్తే డాక్టర్.
నమస్తే.
సో నార్మల్ బీపీ అంటే ఏంటి అసలు?
Normal BP means it is the pressure which is exerted on the blood vessels when the heart is contracting. So when the heart contracts, it exerts a certain amount of pressure on the blood vessels. That is the normal blood pressure. So it has got systolic and diastolic component.
Okay.
So when the heart is contracting, the pressure which exerts is called as systolic blood pressure, and when the heart is relaxed, the pressure exerted on the blood vessel is called as diastolic blood pressure. So there has to be a certain limit for these pressures naturally.
Okay.
So whenever the pressure exerts a certain amount, it causes harmful effects on the body.
Okay.
So there is a range for normal blood pressure, we say. Okay. Normally accepted blood pressure will be, there is a particular range like 120 by 80 is the normal blood pressure, which is defined for all humans.
Okay.
Anything more than that is elevated.
ఓకే. సో ఈ హైపర్ టెన్షన్ కూడా హై బీపీ కిందకే వస్తుందా?
Yeah, hypertension is there are some guidelines which are recommended by like Indian society and American society. As per Indian definition, any blood pressure which is more than 140 by 90 is called as hypertension. Okay. But American guidelines are more strict in these regards. So in those guidelines, any blood pressure which is more than 130 by 80 is considered as hypertension.
ఓకే. ఇప్పుడు హై బీపీ సింప్టమ్స్ ఎలా ఉంటాయి?
See, one thing I want everyone to know is that hypertension is called as silent killer. Okay. In most of the cases, like almost all of the cases, there are no symptoms of hypertension. So only when you get your blood pressure check done, then you come to know that there is hypertension. So that's the reason it is called as silent killer. There are no symptoms and the person is exposed to high blood pressure for a long period of time. So generally it is recommended that you get your blood pressure test done very frequently.
Okay.
So as to rule out hypertension.
ఓకే. ఈ హైపర్ టెన్షన్ కానీ హై బీపీ కానీ ఏ ఏజ్ గ్రూప్స్ లో ఎక్కువగా చూస్తుంటాం?
See, hypertension initially used to be a disease of elderly people. Now even young people are affected with hypertension. So there is no particular age group for hypertension. So it starts with young age also, middle age also, elderly age also.
Okay.
So any age hypertension can be affected, but usually most commonly it is seen after 30 years.
ఓకే. అంటే రీజన్స్ ఏంటి? కమింగ్ టు రీజన్స్.
See, hypertension there is like primary hypertension and secondary hypertension. We divide hypertension as primary and secondary. Primary hypertension is without any specific reason. Okay. There are some genetic factors which contribute to hypertension, hormonal factors, neurological factors which contributes to hypertension, lifestyle changes, all these contributes to hypertension. So when there is no particular identifiable cause of hypertension, it is labeled as primary hypertension.
Okay.
There is another entity called as secondary hypertension. So basically secondary hypertension is any particular specific reason which is causing hypertension, maybe like kidney disease that causes hypertension, that is secondary hypertension, or some endocrine disorders, those also can cause hypertension. Those are secondary hypertension.
Okay.
So basically meaning there are many risk factors for hypertension, mainly essential hypertension which we say.
ఓకే. అండ్ హై బీపీని ట్రీట్ చేయకపోతే ఎలాంటి ప్రాబ్లమ్స్ వస్తాయి?
Yeah. See, many times you have seen that people saying that their blood pressures are like 180, 100 since a long period of time and they are just asymptomatic. But they will be asymptomatic, but the longer the duration blood pressure stays high, the more damage it does inside our body. Okay. So it is recommended that as early as possible your blood pressure has to be controlled. Suppose you are not controlling your blood pressure, that causes something called as target organ damage.
Okay.
Over a long period of time your heart gets damaged. These are the organs which gets affected because of high blood pressure.
Yes.
So you get heart failure, you get heart attacks, you get strokes, you get paralysis, or things, kidney problems develop, you get renal failure, you will be on dialysis. So all these are like, if your blood pressure is not controlled over a prolonged period of time, these things are possible.
ఓకే.
Yeah.
ఒకవేళ బీపీ వచ్చినట్లయితే మళ్ళీ దాన్ని తగ్గించుకోవడానికి లైఫ్ స్టైల్లో చేంజ్ చేయకపోతే ఇలాంటి ప్రాబ్లమ్స్ వస్తాయంటున్నారు కదా, ఎలాంటి ట్రీట్మెంట్స్ ఉంటాయి అసలు బీపీకి?
See, as I said, blood pressure anything more than 140 by 90 is considered as hypertension.
Okay.
And between 120 to 140 systolic and 80 to 90 diastolic is the target where we should approach the target, like when your blood pressure is around like 130/80, you have to start your lifestyle modification.
Okay.
So we say borderline blood pressure, anything less than 140/90 but more than 130/80 is borderline hypertension. So in these persons we implement lifestyle modifications. Lifestyle modification ante indulging in healthy activities. Okay, you have to do regular physical activity. This is to prevent the development of frank hypertension. So in order like your blood pressure should not go beyond 140/90, you have to do lifestyle changes.
Okay.
Lifestyle changes and you have to like do regular physical activity recommended, like they say every like 30 to 40 minutes per day, at least for 4 to 5 days a week.
Okay.
Is the recommended physical activity. Then you have to reduce your weight. All these factors. Then you have to be strict in your diet. There is a diet for hypertension called as DASH diet.
Okay.
Which is like which includes plenty of fruits, vegetables, protein which are like plant based, all these foods, low salt intake, then you have to avoid your alcohols, you have to totally stop tobacco intake, reduce sodium in your food. All these things will prevent the development of frank hypertension.
Okay.
So these measures are helpful when you have like borderline hypertension.
Okay. వన్స్ బార్డర్ లైన్ బీపీ మనకు బార్డర్ లైన్ లో ఉన్నారని తెలిసిన తర్వాత ఈ ప్రికాషన్స్, ఒకవేళ ప్రికాషన్స్ తీసుకోకపోతే అది ఎంత హై వచ్చే ప్రమాదం ఉంది?
See, up to a certain level your precautions will be effective.
Okay.
They will decrease blood pressure to a certain limit, but even then after that if it is not getting controlled, then obviously we have to start the person on medicines.
Okay.
So lifestyle modifications we can try for 3 to 6 months and see if they are not responding, then medicines has to be added for those people.
ఓకే. అండ్ మెడిసిన్స్ విషయానికి వస్తే మెడిసిన్స్ ఇమీడియట్లీ తగ్గుతాయా లేకపోతే టైం పడుతుందా? ఎలా చేయొచ్చు అసలు?
Yeah, see, when the person has very high blood pressure on presentation, we should not wait for lifestyle modification. We should reduce his blood pressure as early as possible. Okay, there is like it is not an urgent condition also, like you should reduce in 1 or 2 days. It can be reduced gradually over a period like 15-20 days. So what we do now is like if blood pressure is very high, we start with dual therapy or triple therapy directly.
Okay.
And then we start 2-3 drugs simultaneously. If the blood pressure is just borderline, is not getting controlled with lifestyle measures, we start a single drug and wait for few days, maybe 15 days, 20 days, then ask the person to come back again, reevaluate him. Depending on that, necessary medicines we have to add.
Okay.
So there is some conditions like called as hypertensive emergencies and urgencies, where the blood pressure is very high. Suddenly blood pressure shoots up to like 220, 100, 110. So in those cases blood pressure we try to reduce immediately. In those cases we use IV medicines to bring down the blood pressure. Okay. If the person is asymptomatic, blood pressure is high, then we tend to reduce the blood pressure gradually.
ఓకే. ఇప్పుడు ఒకవేళ కనుక మనము బీపీ కనుక ట్రీట్ చేయలేదు అంటే దాని కాన్సిక్వెన్సెస్ ఎలా ఉంటాయి అసలు?
Yeah, that's what I told. Like if the blood pressure is not treated over a long period of time, you get target organ damage. That is, you get heart failure, your heart muscles get thickened. That is called as left ventricular hypertrophy. You get diastolic dysfunction. Then eventually heart fails. Your pumping capacity of the heart decreases. You will have odd symptoms of heart failure. That is one thing. Another thing is you can get blockages in the heart vessels. Those increases the risk of heart attacks.
Okay.
Similarly, you get blockages in your vessels which are supplying in the brain. So you get strokes, you get paralysis, on all those things. Your kidneys are affected over a long time. You get kidney failure. Sometimes your eyes get affected. So all these are problems if your blood pressure is not treated over a period of time.
ఓకే. అండ్ బీపీకి మీరు ట్రీట్ చేస్తున్న టైంలో పేషెంట్ ఎలాంటి ప్రికాషన్స్ తీసుకోవాలి?
See, important thing is he has to stick to his medicines regularly. He has to be taking his medicines regularly. On top of that, he should be continuing his lifestyle measures.
Okay.
All those lifestyle measures, strict BP medicines. Sometimes we have seen that a person says after starting the medicines, maybe after 1 month, 2 months, their blood pressure comes to normal. Then the first question they ask is whether we should stop medicines or what, blood pressure has come to normal.
Okay.
No, your blood pressure is normal because you have started medicines. So you have to continue your medicines. Only
for lifetime?
Usually it is lifetime. Okay. Suppose your blood pressure is going less than 110 or something like that. In that case, we can reduce the dose. But without a proper doctor prescription, never stop your BP medicines.
Okay. And systolic, diastolic BP, difference ఏంటి దానికి?
See, initially they used to target diastolic blood pressure, but both systolic and diastolic blood pressures are equally important. Anything more elevated will damage over a long time. Suppose if a systolic blood pressure is 130, diastolic blood pressure sometimes is 100, even that has to be treated.
Okay.
Okay, it is not just the systolic blood pressure which you should target. Both contribute to increase morbidity and mortality. So both has to be targeted.
Okay.
Yeah.
ఓకే బీపీ అనేది జెనెటికల్ గా కూడా వస్తుందా?
Yeah, there are many genetic causes which causes hypertension. As I said, there are many endocrine abnormalities are there, like hormonal imbalance inside the body, but these are very rare causes. Very rare causes. The hypertension which we see commonly is essential hypertension without any specific genetic cause.
Okay.
So there are some indicators which will indicate that there is like secondary cause, like genetic cause. Suppose the person blood pressure is higher side at a very young age. Person is 20 years, 25 years, he has got very high blood pressure. Then we have to think of any secondary cause.
Okay.
A person whose blood pressure is elevated over 35-40 years, then it is likely an essential hypertension.
ఓకే కాలర్ ఉన్నారు తీసుకుందాం. కిషోర్ వనపర్తి నుంచి. నమస్తే అండి.
నమస్తే అండి.
మాట్లాడండి డాక్టర్ గారితో.
సార్ గుడ్ ఆఫ్టర్నూన్ అండి. సార్ నాకు నేను రెగ్యులర్ గా బీపీ చెక్ చేసుకుంటే నాకు వచ్చేసి బీపీ రీడింగ్ 130/90, 95 అలా వస్తుంది సార్. అది అంటే నార్మల్ బీపీ ఉండాల్సింది ఎంత అంటే నాకు కింది రీడింగ్ ఏమో కాస్త ఎక్కువ వస్తుంది, పైన రీడింగ్ ఏమో 125 to 130 మధ్యలో వస్తుంది.
Correct.
అంటే నా ఏజ్ వచ్చేసి 45 years సార్. నా 45 years కు ఎంత ఉండాలి బీపీ?
Okay, right. Thank you, sir. See, as I told, any age blood pressure more than 140/90 has to be treated. Okay, up to this level you can start lifestyle measures, right? There is some entity called as white coat hypertension, like when you go to a doctor to record your blood pressure, that will be on the higher side, but home BP recordings will be normal. So when there is fluctuations in blood pressure in these patients, we ask for something called as ambulatory BP recording. That is, we attach a BP machine that continuously records the blood pressure for 1 or 2 days. We get mean values of those readings. Depending on that, we decide whether the treatment has to be started or not has to be started. In his case, his blood pressure systolic is somewhere around 130, diastolic is 90 to 95. So I think he can try with lifestyle measures.
Okay.
3 months, 6 months he can see strict diet, regular physical activity, weight reduction, avoidance of alcohol, tobacco, salt restricted diet. Commonly used foods, you see pickles, your bakery items, they contain a lot of salts, even breads. People will be not knowing that they are consuming so much salt, but they are present in our food. So once we try these measures, maybe he can try. After about 3 months we can assess his blood pressure, then probably he will respond.
ఓకే ఇంకొక కాలర్ ఉన్నారు సలీం మిర్యాలగూడ నుంచి. నమస్తే అండి సలీం గారు. నమస్తే, మాట్లాడండి డాక్టర్ గారితో. హలో. ఓకే, కాల్ కట్ అయినట్టుంది. సో ఇప్పుడు జెనెటికల్ ప్రాబ్లమ్స్ ఎర్లీ స్టేజ్లోనే ఒకవేళ వస్తే గనక వాళ్ళని అసలు ఎలా ట్రీట్ చేయాలి అనేది మాట్లాడుకున్నాం కదా. ఒకవేళ రాకముందే ఎలాంటి ప్రికాషన్స్ తీసుకోవాలి వాళ్ళు
ఫర్
జెనెటికల్ ప్రాబ్లమ్స్ ఉన్న వాళ్ళు?
ఓకే, no, that is only you can get regular checkup and only then you will come to know whether hypertension is there or no.
Okay.
See, if hypertension is there, there are some treatable causes. Okay, like there is something called as coarctation of aorta, where your blood vessel get narrowed. If that is causing hypertension, that has to be corrected, and that is treatable cause. Okay, there is another condition called as adrenal hyperplasia, aldosteronism. All these are genetic causes. There are specific causes and specific treatment is available for these causes. Okay. So once we rule out these causes, accordingly we have to investigate, and treatment will be according to each genetic disorder which is causing that hypertension.
ఓకే, అండ్ మెయిన్గా ఈ హైపర్ కి రీజన్స్ ఏంటి? లైఫ్ స్టైల్ మోడిఫికేషన్సే కాకుండా ఇంకేం ఉంటాయి అసలు రీజన్స్?
See, our lifestyle has changed right now. We lead a sedentary lifestyle. Lot of risk factors are there. Stress is there. All these things, we are not into regular physical activity. These are predisposing factors for hypertension.
Okay.
So any person who has crossed middle age is likely prone for hypertension. It is such a common thing that in US they say 1 in 3 adults is hypertensive. So it is such a common thing. Only thing is it is not diagnosed. People don't go for checkup and they miss these things. Okay. So basically it is a combination of factors, risk factors, sedentary lifestyles. These predispose to hypertension in these people.
ఓకే. అండ్ చాలా మందికి బ్యాడ్ కొలెస్ట్రాల్ ఎక్కువ ఉంటుంది, బార్డర్ లైన్ లో ఉంటారు, వాళ్ళకి కూడా బీపీ వచ్చే ఛాన్స్ ఉందని డాక్టర్స్ చెప్తూ ఉంటారు, ఇది నిజమేనా?
No, usually cholesterol and see these are like they fit into a syndrome called as metabolic syndrome. So metabolic syndrome has got certain components that includes diabetes, cholesterol, hypertension. So whenever there are chances of hypertension, there can be possibilities that you can have also other problems. You can have high cholesterol, you can have high blood sugars. So always whenever there is hypertension, better to do screening for other diseases. Sugar test you have to do, cholesterol test you have to do as a precaution. It is not that if cholesterol is elevated, definitely your blood pressure will be high. That is not accurate actually. So just it can be associated. Okay, to rule out this disease, it also better to get those tests done.
ఓకే. అండ్ వన్స్ బీపీ వచ్చిన తర్వాత లైఫ్ టైంలో ఇంకా కంటిన్యూస్ లైఫ్ లాంగ్ మెడిసిన్స్ వాడాల్సిందేనా?
Yeah, majority of the time it will be lifelong. Only if your blood pressure is going down beyond a certain limit, then probably you have to reduce the dose or maybe stop completely. If BP goes down suddenly, you will have symptoms of giddiness, syncope. In that case, better to get evaluated, and if possible we can reduce the dose.
Okay.
But majority of the time it will be lifelong.
ఓకే. అండ్ చాలా మందికి లో బీపీ వచ్చిన వాళ్ళకి మీరు చెప్పినట్లుగా డిగినెస్ అదంతా కనిపిస్తూ ఉంటుంది. హై బీపీ వచ్చినప్పుడు నార్మల్ పీపుల్ దీని గురించి ఏం తెలియని వాళ్ళు ఎలా తెలుసుకోవచ్చు అసలు హై బీపీ ఉంది నాకు అని?
That's what I'm saying. See, many people have like a misconception. If there is high blood pressure, they'll have some headache, they'll have irritability. These are there, but they're not always present. So as I said, hypertension, you have to get that. Only way to confirm the diagnosis is get regular checkup done. Majority of
డయాగ్నోస్ లోనే తెలుస్తుంది.
Yes, majority of them because it is asymptomatic. Suppose if your blood pressure is high for a long period of time, directly you will end up in stroke if you don't get it checked done, because you will not be having any symptoms. So you will come with stroke. Only then you will come to know I had hypertension since long time. So that's the reason a regular checkup is a must to detect hypertension.
ఓకే.
Most of the time it is asymptomatic.
ఓకే. అండ్ కమింగ్ టు ఫుడ్ హ్యాబిట్స్, ఎలాంటి ఫుడ్ హ్యాబిట్స్ ఉండాలి వాళ్ళకి?
Yeah, see the food, as I told, it should be like rich in fruits and vegetables. Avoid all fatty foods, oily foods, foods which are high in saturated fats has to be avoided. Protein intake has to be more, basically plant rich proteins. Okay, your main is the salt. They say it had to be less than like 2 grams, 2.5 grams, not more than that per day. That is just about 1 tablespoon of salt, like that. Okay, anything more than that will increase your blood pressure.
ఓకే. ఇదంతా మీరు ట్రీట్మెంట్ చేసుకున్న వాళ్ళకి ఫుడ్ హ్యాబిట్స్, రైట్?
This is like even those people whose blood pressure is borderline,
ఓకే,
even they has to maintain this type of diet to prevent the development of frank hypertension.
ఓకే. వన్స్ బీపీ కంట్రోల్లోకి వచ్చిన తర్వాత వాళ్ళు సాల్ట్ ఇంటేక్ చేయొచ్చా?
No, as a precaution they have to keep maintaining those diet for lifelong. That will be better, because one of the cause of persistent hypertension which is not improving in spite of medicines is regular salt intake.
Okay.
Sometimes we add 2 drugs, 3 drugs, 4 drugs, blood pressure is not coming down. It is basically the excess salt in the body. Medicines won't act if excess salt is there.
ఓకే.
So they have to
వేరే
continue
ప్రాబ్లమ్స్
this.
కూడా వస్తాయి అంటే బీపీ హై ఉన్న వాళ్ళకి ఇంకా వేరే ప్రాబ్లమ్స్ కూడా వస్తాయి కదా, వాటికి కూడా మెడిసిన్స్ తీసుకోవాల్సి ఉంటుంది వాళ్ళు?
Yeah, they have to take both. Like if cholesterol is there, that also they have to take. Sugar also they have to take. But lifestyle modifications has to be continued throughout the life.
ఓకే. కమింగ్ టు ట్రీట్మెంట్స్, వీటికి ఎలా ట్రీట్ చేస్తారు అసలు? బార్డర్ లైన్ లో ఉన్న వాళ్ళకి ఎలా ట్రీట్ చేస్తారు? హై బీపీ ఉన్న వాళ్ళకి, లేదు లైఫ్ స్టైల్ కరెక్ట్ గా చేసుకుంటున్న వాళ్ళకి ఎలాంటి ట్రీట్మెంట్స్ ఉంటాయి అసలు?
If it is borderline hypertension less than 140/90, as I said, lifestyle changes, diet are enough for those people. But if the blood pressure in spite of lifestyle changes it is more than 140/90, then we start medicines. Okay, there are a lot of medicines, many classes of drugs are there. If the blood pressure on presentation is very high, 160, 100, we started double drug combination or sometimes triple drug combination. The blood pressure is just borderline, we start a single drug and just keep observing.
ఓకే.
Yeah.
ఓకే. అండ్ హై బీపీ వచ్చినప్పుడు వచ్చే కాన్సిక్వెన్సెస్, దాని తర్వాత ఎంత టైం పడుతుంది తగ్గడానికి?
See, most of these changes will be irreversible. That you should understand. Some changes are reversible. Suppose if the heart is affected because of high blood pressure, there is left ventricular hypertrophy. Once you control your blood pressure, like over a period of few weeks to months, that hypertrophy will regress. Heart will come back to its normal state. But some things are reversible. Like suppose you develop a stroke because of hypertension, that cannot be reversed. You develop renal failure because of hypertension, that cannot be reversed. Okay, so better to treat hypertension than to wait for like developing complications and which are like not reversible.
ఓకే ఓకే. అండ్ చాలా మందికి డయాబెటీస్ లో మనం చూస్తాం కదా, ఎవరికైనా సర్జరీ చేయాలి అంటే కొంచెం కాంప్లికేషన్స్ వస్తూ ఉంటాయి. అట్ ద సేమ్ టైం బీపీ ఉన్న వాళ్ళకి కూడా ఏదైనా సర్జరీ, వేరే సర్జరీ చేయాల్సి వస్తే ఎలా ట్రీట్ చేస్తారు వాళ్ళని?
కరెక్ట్. See, whenever any surgery is anticipated, blood pressure has to be in the normal range.
Okay.
If you are doing surgery with high blood pressure, there will be high chances of bleeding, heart attacks, other things. So we try to reduce the blood pressure before the operation as normal as possible. We give medicines. If it is too high, we give IV medicines. If it is borderline, just with oral medicines we will treat before surgery. But it has to be corrected before any surgery.
Any surgery. Okay. Caller unnaru Begum Anantapur nunchi. Namaste andi.
నమస్తే మేడం.
మాట్లాడండి డాక్టర్ గారితో.
సార్ అస్సలాము అలైకుం సార్.
Alex.
సార్ మా కోడలు సార్ లాస్ట్ మంత్ లో బీపీ ఎక్కువ అయిపోయి 180లో పాప చనిపోయింది సార్. చనిపోయి పుట్టింది. మళ్ళీ కడుపుతుంది సార్, ప్రెగ్నెంట్ పాప. మళ్ళీ 4 months సార్, 140 బీపీ సార్.
ఓకే, 4 months ప్రెగ్నెంట్, 140 బీపీ ఉంది. ఆల్రెడీ ఒక డెలివరీ టైంలో బీపీ ఎక్కువై పాప చనిపోయింది. సెకండ్ ప్రెగ్నెన్సీ 4th month, 140 బీపీ ఉంది.
Okay. No, during pregnancy blood pressure has to be strictly controlled. Okay, it has to be strictly under the recommended range. Okay. First pregnancy blood pressure is high, second pregnancy also blood pressure is high, then medicines has to be given. Medicines during pregnancy will be slightly different from what we use during other people. Okay. But this blood pressure has to be controlled with proper medicines, or else that can lead to a lot of complication in pregnancy.
Yes.
There is something called as eclampsia, where the person can develop like seizures, fits, everything are possible if blood pressure is not controlled in pregnancy. So this blood pressure has to be controlled. Medicines are different than what we use normally.
ఓకే ఓకే. అండ్ ప్రెగ్నెన్సీ టైంలో నార్మల్గా బీపీ లేని వాళ్ళకి కూడా ప్రెగ్నెన్సీ టైంలో థైరాయిడ్, డయాబెటీస్, బీపీను ఇవి వస్తూ ఉంటాయి కదా, ముందుగా ప్రికాషన్స్ తీసుకోవాలా వీటికి?
See, there's entities called as gestational diabetes, gestational hypertension. That during pregnancy only you get these changes. Okay. As already told, lifestyle changes has to be followed during pregnancy also. But even then, blood pressure is higher than the recommended range. Definitely, you have to treat.
Okay.
Okay. Precautions. If they are prone for these things, then definitely precautions has to be more careful. Like frequent visits to hospital, frequently getting checked your blood pressure done. And if it is high, then definitely treatment is indicated.
ఓకే. అండ్ చాలా మందికి బీపీ ఎక్కువ అయితే పెరాలసిస్, ఫస్ట్ వచ్చేది పెరాలసిస్, స్ట్రోక్. ఆ స్ట్రోక్ రాకముందే వాళ్ళు ఒకలాంటి షివరింగ్ ఇలాంటివి ఫేస్ చేస్తూ ఉంటారు కదా, అలాంటి టైంలో వస్తే వాళ్ళకి రాకుండా చేయొచ్చా పెరాలసిస్ ఇలాంటివి?
No, strokes they are usually sudden in onset. Strokes, once it happens, it is not like preventable, nothing like that.
Okay.
So once you develop a stroke, you have to treat it, nothing else. So a person cannot know that he is developing stroke. So it happens suddenly and it is like once in a time. So best is to control the blood pressure before itself.
Okay.
Not wait for development of stroke or any symptoms of stroke. So control your blood pressure, then possibility of stroke itself reduces.
ఓకే. అండ్ ప్రెగ్నెన్సీ టైంలో వచ్చి వెళ్ళిపోతుందా, లేకపోతే తర్వాత కూడా ట్రీట్ చేసుకుంటారా?
Majority of the time it comes down. Once after pregnancy blood pressure comes down, it normalizes, but in few cases occasionally blood pressure persists. If it persists, treatment has to be taken lifelong.
For lifetime.
Yes.
అండ్ కామన్ గా బీపీని, హై బీపీని ఆఫ్టర్ 30 చూస్తామా, ఆఫ్టర్ 40 చూస్తామా ఈ లైఫ్ స్టైల్లో?
No, now we are seeing in 25 years people developing hypertension.
Okay.
So we recommend that almost yearly everyone gets their blood pressure and all routine screening for diabetes, cholesterol as early as possible. Yeah, it is better if you go up at 30 only, not wait for 40 years.
ఓకే. ఒకవేళ బార్డర్ లైన్ లో ఉంటే ముందే ట్రీట్ చేసుకుంటే హై బీపీ వరకు వెళ్ళకుండా.
Problem with hypertension is if you leave untreated for a long time, that causes target organ damage. Main aim of treating hypertension is it has to be in the recommended range. If it is in the recommended range, your target organ damage will not be there. So that is the main purpose of treating hypertension and detecting early.
Okay.
The longer your blood pressure is uncontrolled, the more damage it causes inside your body, and which is irreversible.
ఓకే. అండ్ ఫైనల్ గా ఎలాంటి ఫుడ్ హ్యాబిట్స్, ఎలాంటి లైఫ్ స్టైల్ ఉండాలి?
Healthy lifestyle which includes a regular physical activity, 30-40 minutes per day, 4 to 5 days a week. Almost everyone should do these activities. That is recommended. Same thing, avoiding like fatty food, diet full of fruits, vegetables, avoid saturated foods, avoid bakery items, junk food, pizzas, burgers, those things has to be avoided naturally. They contain a lot of sugar and saturated fats.
Preservative foods, right?
Preservative foods, yes. All frozen foods, they contain too much salt in that.
అవును అవును.
A healthy homemade food is always better than having outside food, yes.
ఓకే, థ్యాంక్ యూ సో మచ్ డాక్టర్. చూసారు కదండి, ఇది ఇవాల్టి జీవనరేఖ కార్యక్రమం. నమస్కారం.